With hospitalizations higher than ever before, the job of frontline workers is becoming even more challenging. Hospitals are pleading with Ohioans to slow the spread.
We're going to see hospitalizations continue to rise. So I think we can't sound the alarm bell loud enough.
Doctors estimate that we could see Thanksgiving infections turn into hospitalizations in 2 to 3 weeks after the holiday.
Adding even more pressure to an already stressed system. Thanks for staying up with us tonight at 11, everybody. I'm Kerry Charles.
I'm Colleen Marshall, and tonight we're hearing from doctors and nurses from a COVID-19 floor.
NBC4's Eric Halpern is live at the OSU Wexner Medical Center. Eric, what is it like for these healthcare workers?
Carrie, the increasing number of hospitalizations are more than just numbers to these frontline workers, much more. They're people needing beds, more people needing beds on their floors, more people needing ventilators. And they say it's getting hard, continuing to see more and more patients brought into the ICU. Some of Central Ohio's most critically ill COVID-19 patients are in the intensive care unit at the Ohio State Wexner Medical Center. Also on those floors, Dr. Matthew Wexner.
We all come together, we say, what are we doing for this patient today? A lot of it is just, getting them through the day.
That's what's done every day for every patient. Recently, the work's gotten even harder as COVID-19 hospitalizations continue to climb.
I think the thing that makes it a harder struggle now is everyone's already been through this once. And so the adrenaline that propelled everyone through the first phase has kind of waned.
But in some ways, Dr. Exline says the situation is better than the spring because they have improved treatment for coronavirus patients and the good news about vaccines. By the time patients get to him, they're usually on ventilators and cannot talk. Family members have told him their loved ones have gotten COVID-19 doing things they didn't think were risky. Dr. Exline hopes that behavior stops.
We only get there if we work hard now. And if we just keep doing what we're doing, it probably isn't going to happen in the near future. And a lot of other people are going to suffer in the meantime.
Also working in the ICU is nurse manager Hunter Jeffers. For 8 months now, like nurses across the country, his team has been and continues to be on the front lines.
Doing this for 12 hours and going from room to room or doing chest compressions, it's very hard work. They are amazing at what they are doing, but they shouldn't have to do this for this long.
Oftentimes, the nurses have to flip patients onto their stomachs so they can breathe better. Jeffers says the hardest part of the pandemic is when nurses have to hold iPads up so families can have their last moments.
And I hate that anyone has to do that job. I don't want anyone in our state to wait until one of their family members is in an ICU to take this pandemic seriously.
And as for what keeps them going, especially during some of those incredibly tough times, Jeffers says they have an extremely supportive team here, and also the success stories, seeing people eventually leave the ICU, and though it may take a while, also going home. Local for you in Columbus, I'm Eric Halpern, NBC4.